On this video today we shall be talking about bacterial vaginosis symptoms and home treatment. What it is, the causes and symptoms, the cheap and easy to use home treatment. Hi everyone and welcome to our channel. I'm here again from Health and Fitness Advisor, where we post videos answering your health questions that might be bothering you and also teach you on how to get your sound health back and in a simplified manner. If this is the first time of you coming to our channel, please go down the bottom below. Hit that subscribe button. And turn on all the notifications, so that when we post new videos you can be notified. And also for you not to miss out on any of the good stuff that is happening here. Today we shall be talking about bacterial vaginosis symptoms and home treatment. What it is, the causes and treatment. Now, let's dive into it step by step in details. And please make sure you stick to the end where I will show you the symptoms. And also the different home remedies, that is cheap, easy to use for treatment of this condition step by step and never to come back again. Bacterial vaginitis, also known as vaginitis, is the inflammation or irritation of the vagina caused by an imbalance of bacteria. Women may have different kinds of bacteria in their vagina. Some species are good and can help keep the body's pH level stable, while others are harmful and need to be eliminated. When they are gone, the pH balance shifts and bacterial vaginosis occur. This shift in vaginal bacteria can be caused by many things such as an imbalance in the immune system, sex, birth control pills, or even medications. There are a number of treatment options available to treat bacterial vaginosis. Many women turn to over-the-counter or prescription antibiotics because these medicines are widely available at the drugstore and they seem to work well to clear up the problem. But because antibiotics kill off all the bacteria in the body, it is not a long-term solution. The body quickly develops a natural immunity to antibiotics and the treatment becomes ineffective. In addition, many women who use antibiotics for a recurring case of BV find that the infection reoccurs after they stop taking the antibiotics. Please, if you like this video, hit the like button to give us a thumb up. And the subscribe button as well. And don't forget to turn on all the notifications. Now, let's continue with the steps. However, bacterial vaginosis can also be treated with simple steps, at home, that don't require the use of antibiotics. These simple steps include proper hygiene, douching, maintaining a healthy diet, and balancing your hormones. Although some of these factors are easier to deal with than to take antibiotics, the overall effect is the same: you eliminate the overgrowth of bacteria in the vagina. It is quite common for bacterial vaginosis symptoms to include itching, burning, and foul-smelling odors. In many women, the symptoms are very mild and can be easily mistaken for ordinary everyday symptoms such as fishy odor or vaginal discharge that doesn't smell at all. If the symptoms are more severe, you may experience pain during sexual intercourse or even bleeding after intercourse. If you experience one or more of these symptoms, see your doctor immediately to get diagnosed. There are several things that can cause bacterial vaginosis. Having multiple sex partners, especially those who don't practice safe sex, is one way that men can get an infection. Cigarette smoking, obesity, pregnancy, and diabetes can also cause symptoms to flare up. If you think you are experiencing any of these symptoms, make an appointment with your doctor immediately to determine the root cause and find a treatment that will go away. Although many of the symptoms of bacterial vaginosis are quite mild, they can be quite uncomfortable and can interfere with your daily life. Some of the most common symptoms of BV are abnormal vaginal discharge, painful urination, and a fishy odor. Each of these symptoms manifests itself in a slightly different way, but each of them can be equally distressing. Abnormal vaginal discharge is often described as having a thick, yellowish consistency. It may also have a strong, unpleasant odor and feel to it. Abnormal vaginal discharge is a good indicator of bacterial vaginosis, but not necessarily a full-blown infection. If you're concerned about symptoms of bacterial vaginosis and suspect that you might have it, see your doctor immediately. He or she will be able to take a swab test to confirm if you do have an infection and then determine which type it is. The three most popular are antibiotics, creams, and natural remedies. Each of these options has its own benefits and drawbacks. The best bacterial vaginosis home treatment is going to depend on your individual circumstances. Here's how to choose the treatment that's right for you. A common bacterial vaginosis treatment option is the use of metronidazole. This is a topical cream that you apply directly to the outside of the vagina. This is the most common treatment choice for BV, however, it does come with some drawbacks. First, if you miss a dose, you'll have to reapply. Second, the concentration level of metronidazole used might not be high enough to kill all of the bacteria. Clindamycin, another common bacterial vaginosis treatment option, is taken in orally. It's available in different forms: bars, capsule, liquid, etc. Clindamycin works by killing off the bacteria in your vagina. Although it kills off the bacteria in your vagina, clindamycin can also cause side effects like redness, burning, itching, and vaginal discharge. Clindamycin is usually prescribed as a last resort for bacterial vaginosis treatment because of these side effects. If you take clindamycin, you should know that the good bacteria in your body may become depleted as well. This means that you'll need more of the good bacteria to keep your body healthy. So while this might sound bad, if you don't want to get worse, you should try a more traditional bacterial vaginosis treatment. Another bacterial vaginosis treatment option is a natural remedy called yogurt. Yogurt contains Lactobacillus acidophilus bacteria, which are already helpful in getting rid of BV. You simply need to apply the yogurt directly onto your vagina or use a suppository if you prefer. Yogurt will also help restore the natural pH of your vagina, thereby making it less acidic. You can also try douching with tea tree oil. Tea tree oil has antiseptic properties that can kill off the harmful bacteria in your reproductive tract. Mix 3 to 5 drops of tea tree oil with 1 quart of water and douche. The douche must be done 2 to 3 times a week. This will help restore the pH balance of your vagina. Boric acid suppositories for bacterial vaginosis treatment have been around for many years. The reason they are so good at helping women get rid of their problems is that boric acid suppositories act on the bacteria inside your vagina very much like an antibacterial vaginal ring. They kill off all of the anaerobic bacteria in your vagina. This is why they have become so popular, as they do what doctors never could: relieve symptoms without any negative side effects at all. If none of the previously mentioned bacterial vaginosis remedies are effective, then it's time to see your doctor. Don't be embarrassed to tell him, her about your problem. Your doctor knows everything there is to know about sexually transmitted infections. Doctors usually prescribe a course of antibiotics. But remember that antibiotics can damage your immune system, so it's always better to stick to natural bacterial vaginosis treatment methods. In case you're wondering whether you're really suffering from bacterial vaginosis or not, you'll get BV if you have any of the following symptoms: vaginal discharge with a foul odor, itching or burning sensation, pain during sexual intercourse, and painful urination. These symptoms indicate that you have an active infection. So when you suspect that you might have BV, see a doctor right away. Let the doctor examine your vagina to confirm the diagnosis so he can get on to treating your disease. There are many reasons why you might have BV, but the most common cause is poor hygiene. But even if you take great care of your genitals, there are still risk factors that will lead to your infection. These include having multiple sex partners, having sex with someone who has a different sex partner than you do, and not using condoms. Condoms will not only reduce your risk of getting bacterial vaginosis, it will also prevent the transmission of other STDs. So if you're having unprotected sex, make sure that you use a condom every time you have sex, and you'll be protected from all STDs. You also have to consider how risky having sexual intercourse can be for you. Not only do you put yourself at risk by having an active infection, you put your partner's life at risk as well. Bacterial vaginosis is treated differently depending on the severity of your infection. If you don't want to take drastic measures like having a surgery or spending thousands of dollars for a treatment plan, then use condoms and protect yourself from STDs. Treatments like antibiotics are a good way to eliminate the symptoms temporarily, but they don't remove the risks posed by sex and using contraceptives. For more detailed treatment, check the link in the description below. If you're interested in trying them, they are made of healthy food and lifestyle. And you can even make them yourself at home. If you enjoyed these video, make sure you smash the like button in appreciation. Also, go down below the bottom and comment. Let us know what you think about this video. And don't forget to also check our blog. The link is in our description below this video. Let us know how we can help you for a better health. And more importantly, so we can grow together in good health. Thank you so much for watching another one of our videos. Again, from Health and Fitness Advisor, always keep yourself healthy. And until next time, please stay safe. And, till see next time, goodbye.